Hello everyone, welcome back to channel Medical with Sanju. हामी हेर्दै थियौ नेपाल नर्सिङ काउन्सिल मोडल एक्जाम सेट 75 वटा क्वेशन भइसकेको थियो रिमेनिङ क्वेशन चाहिँ क्वेशन नम्बर 76 A client with pyrexia will most likely demonstrate option A dyspnea, option B precordial pain, option C elevated BP, option D increased pulse rate. Pyrexia means fever. Fever is a symptoms. Fever हाम्रो बडीमा आउँदा फिभरले गर्दा चाहिँ पल्स रेट हाई हुन्छ. अप्सन डी इज राइट एन्सर. फिभर चाहिँ कुनै इन्फेक्सन भएर हाम्रो बडीमा चाहिँ आएको हुन्छ. क्वेशन नम्बर 77 मसल फ्याटिग इज ड्यू टु अप्सन ए केटोन बडीज, ऑप्शन बी लैक्टिक एसिड, ऑप्शन सी, ऑप्शन डी ओक्सा एसिटिक एसिड. Lactic acid. Option B is right answer. Lactic acid is formed and accumulated in the muscle under conditions of a high energy demand, rapid fluctuations of the energy requirements, insufficient supply of the O2 during intensive exercise, sustained to fatigue, muscle pH decreases to about 6.4 to 6.6. Question number 78. Which assessment data would indicate a potential complication associated with the skin on an older adult? Option A crusting, option B wrinkling, option C depending of expression lines, option D thinning and loss of elasticity in the skin. Potential complications सोधेको छ. नर्मल फिजियोलोजिकल चेन्जेसमा लाइक यसमा खास गरी स्किनको प्रब्लमहरू आउँछ जस्तै कि थिनिङ अफ स्किन, लस अफ इलास्टिसिटी, डिपेन्डिङ अफ एक्सप्रेसन लाइन एन्ड रिङ्कलिङ. यो सबै भनेको फिजियोलोजिकल चेन्जेसमा आउँछ. तर पोटेन्सियल कम्प्लिकेसनमा क्रस्टिङ आउँछ. अप्सन ए इज राइट एन्सर. क्वेशन नम्बर 79. टर्स organism include except option A chickenpox, option B tuberculosis, option C rubella and option D herpes. टर्च को फुल फर्म हुन्छ टोक्सोप्लाज्मा गोनिडी, रुबेला भाइरस, साइटोमेगालो भाइरस एन्ड हर्प्स भाइरस. यसमा चाहिँ ट्युबरक्लोसिस आउँदैन. सो राइट एन्सर अप्सन बी भयो. क्वेशन नम्बर 80. Persons with which of the following traits are resistant to Plasmodium vivax infection? Option A thalassemia, option B sickle cell anemia, option C Duffy negative RBC and option D hemoglobin F. The right answer is option C Duffy negative RBC. Persons whose red blood cells are Duffy negative means genetic trait are resistant to P. vivax infection. Sickle cell traits have a middle illness with falciparum infections than do those with normal hemoglobin. Question number 81. Which of the following vitamin is not stored in liver? Option A vitamin A, option B vitamin B, option C vitamin C and option D vitamin D. There are two types of vitamin, water soluble vitamin and fat soluble vitamin. A, D, E, K are fat soluble vitamin and B and C are water soluble vitamin. Water soluble vitamin is not stored in a liver. Water soluble vitamins dissolved in water and not stored. They are eliminated in urine. We need a continuous supply of them in our diet. Question number 82. The ultimate digestion of protein occurred in the form of option A amino acids, option B glucose, option C fatty acid, and option D peptide. The right answer is option A amino acid. Proteins are made from amino acids joined together and are the main family of molecules from which the human body is built. Question number 83. Which assessment finding indicated a worsening of the preeclampsia and the need to notify the healthcare provider? Option A urine output has increased. Option B dependent edema has reduced. Option C blood pressure reading is at the prenatal baseline. Option D the client complains of a headache and blurred vision. Preeclampsia, that means pregnancy induced hypertension. यसको मेन सिम्टम्स हुन्छ ब्लड भिजन एन्ड हेडेक. If the client complains of a headache and blurred vision, the healthcare provider should be notified because these are the signs of worsening preeclampsia. Question number 84. The nurse is monitoring a client in labor. The nurse suspected umbilical cord compressions, if which is noted on the external monitor tracing during a contraction. Option A, option B accelerations, option C yearly declarations, option D variable declarations. The right answer is option D variable declaration. It occurs if the umbilical cord becomes compressed, reducing blood flow between the placenta and the fetus. Variability refers to fluctuations in the baseline fetal heart rate. Accelerations are a sign and usually occur with the fetal movement. Yearly declaration result from pressures on the fetal head during a contraction. Question number 85. Which time frame should the nurse relay to the postpartum client regarding the returns of bowel function? Option A 3 days postpartum, option B 7 days postpartum, option C on the day of birth, and option D within 2 weeks of postpartum. The right answer is option A 3 days ma bowel function चाहिँ return भएर आउँछ. After birth, the nurse should auscultate the client's abdomen in all 4 quadrants to determine the returns of bowel sound. Normally, bowel elimination usually return 2 to 3 days postpartum. Surgical मा एनेस्थेसिया चाहिँ दिएको हुन्छ अथवा चाहिँ ओपोइड चाहिँ युज गरेको हुन्छ पेन कन्ट्रोल गर्नको लागि. त्यही भएर चाहिँ अलिकता यसमा के हुन्छ लङ टाइम लाग्छ बाउल फंक्सन रिटर्न हुनमा, बट नर्मल भेजाइनल डेलिभरीमा 2 to 3 days मा रिटर्न आउँछ. Question number 86. Which nursing action is most effective in preventing heat loss by evaporation in newborn? Option A warming the crib bed, option B closing the doors to the room, option C drying the infant with a warm blanket, option D turning on the overhead radiant warmer. The right answer is option C. बेबीलाई चाहिँ हिट लस हुनबाट प्रिभेन्ट गर्नका लागि वार्म ब्ल्याङ्केटले कभर गर्नुपर्छ. यसले के हुन्छ इभ्यापोरेशन्स अफ द मोइस्चर फ्रम अ वेट बडी dissipates heat along with a moisture. Keeping the newborn dry by drying the wet newborn at birth prevents hypothermia by evaporation. Evaporation द्वारा जुन हाइपोथर्मिया भइराखेको हुन्छ बेबीमा त्योबाट प्रिभेन्ट हुनका लागि के गर्नुपर्छ ब्ल्याङ्केटले कभर गर्नुपर्छ. क्वेशन नम्बर 87. Methylgonopin is prescribed for women to treat postpartum hemorrhage. Before administrations of this medicine, what is the priority assessment? Option A uterine tone, option B blood pressure, option C amount of leukemia, and option D deep tendon reflexes. The right answer is option B, blood pressure. मिथाइलगोनोभिन यो चाहिँ पोस्टपार्टम हेमोरेज कन्ट्रोल गर्नका लागि युज गर्छ तर कन्टिन्यू रूपमा यो मेडिसिन युज गर्दाखेरि ब्लड प्रेसर इन्क्रिज हुने चान्सेस हुन्छ त्यही भएर यो मेडिकेसन स्टार्ट गर्नुभन्दा अगाडि ब्लड प्रेसर चेक गर्नुपर्छ क्वेशन नम्बर 88 Which resting positions should a nurse encourage for a client with a pelvic inflammatory disease PID? Option A, Sims position. Option B, floor position. Option C, supine with a knee flex. Option D, lithotomy with the head elevated. The right answer is option B, floor position चाहिँ maintain गर्नुपर्छ. Question number 89. A nurse is assessing a pregnant client during the third trimester. What clinical finding is an expected response to the pregnancy? Option A, tachycardia. Option B, dyspnea at rest. Option C, progressive repeated edema. Option D, shortness of breath on exhaustion. Shortness of breath. Option D is right answer. Shortness of breath on exhaustion is an expected cardiopulmonary adaptation during pregnancy caused by an increased ventricular rate and elevated diaphragm. Question number 90. How does the nurse identify true labor as opposed to false labor? Two types of labor हुन्छ true labor and false labor. कसरी चाहिँ डिफरेन्सेस गर्ने दुईटैलाई Option A, cervical dilation is progressive. Option B, contraction stop when the client walks around. Option C, client's contractions progress only in a sideline position. Option D, contraction occurred immediately after the membrane rupture. Cervical dilation is progressive. Option A is right answer. Cervical dilation is progressive in a true labor. With a true labor, contraction will increase with the activity. Question number 91. Which breathing techniques should the nurse instruct the client to use as the head of the fetus's crowning? Option A, shallow. Option B, blowing. Option C, slow chest. Option D, modified pitch. Option B. Question number 92. When a client's legs are placed in a strips for birth, the nurse confirms that both legs are positioned simultaneously to prevent. Option A, venous status in the leg. Option B, pressure on the perineum. Option C, excessive pull on the fascia. Option D, trauma to the uterine ligaments. Birth को बेलामा lithotomy position maintain गर्छ किन गर्छ होला To prevent trauma to the uterine ligaments. Option D is right answer. Question number 93. When caring for a woman who had a positive contraction stress test CST, what complication does the nurse suspect? Option A, preeclampsia. Option B, placenta previa. Option C, immediate preterm birth. And option D, uteroplacental insufficiency. A positive contraction stress test CST indicates a compromised fetus with a late declaration during contractions. This is associated with a uteroplacental insufficiency. Option D is right answer. Question 94. When does a nurse caring for a client with eclampsia determine that the risk for another seizure has subsided? Option A, after birth occurs. Option B, after labor begins. Option C, 48 hours postpartum. And option D, 24 hours postpartum. Pre-eclampsia blood pressure high भएको हुन्छ but eclampsia hypertension with seizure पनि आएको हुन्छ र यो कतिखेर चाहिँ सबसाइडेड हुन्छ भन्दाखेरि 48 hours after birth postpartum मा. Option C is right answer. The danger of seizure in women with eclampsia subsided when the postpartum diuresis has occurred, usually 48 hours after birth. However, the risk for seizure may remain up to 2 weeks postpartum. 2 weekसम्म चाहिँ आउने चान्सेस हुन्छ. Question 95. What is the primary nursing intervention for an infant with a myelomeningocele before surgical correction? Option A. Minimize infection. Option B. Prevent trauma to the sac. Option C. Observe for increasing for paralysis. And option D. Assess the degree of bowel and bladder control. The right answer is option B. Question 96. What should a nurse use to feed an infant born with a unilateral cleft lip and palate? Option A. Plastic spoon. Option B. Cross-cut nipple. Option C. Parenteral infusion. And option D. Rubber tipper syringe. Rubber tipper syringe is the right answer. Question number 97. What is the essential nursing actions when caring for a young child with severe diarrhea? Option A. Maintain the IV. Option B. Take daily weights. Option B. Replace the loose calories. And option D. Promote perineal skin integrity. Weight is the best indicators of a fluid loss or a gain if measured each day at the same time, on the same scale and with the same amount of clothing. 1 liter of fluid weight 2.2 pounds. Option B. Question 98. What is the common finding that the nurse can identify in the most children with symptomatic cardiac malformations? Option A. Mental retardation. Option B. Inherited genetic factors. Option C. Delayed physical growth. And option D. Clubbing of the fingers. Cardiac malformations मा चाहिँ delay physical growth हुन्छ. Option C is right answer. Question 99. A nurse on the pediatric unit is observing the developmental skills of several 2 years old children in the playroom. Which child should the nurse continue to evaluate? Option A. Cannot stand on one. Option B. Bulls of 7 blocks. Option C. Uses echolalia when speaking. Option D. Colors outside the lines of a picture. Echolalia in a 2-year-old child may be a sign of autism. Imitation of a sounds begins at about 6 months of age and may continue for several more months. The average 2-year-old child has a 300-word vocabulary and uses 2 to 3 words. The right answer is option C. Uses echolalia when speaking. Question 100. What type of a play does a nurse expected when observing a toddler in a playroom with other children? Option A. Parallel. Option B. solitary. Option C. cooperative. And option D. competitive. The toddler मा चाहिँ parallel हुन्छ. Option A is right answer. The toddler is still dependent on the primary caregiver and play alone but is aware of other player. Solitary play अथवा चाहिँ on-cooker play is a characteristics of the infant मा चाहिँ यो हुन्छ. and cooperative play pre-schooler मा हुन्छ र competitive play schooler age मा हुन्छ. infant 1 year को बेबीलाई 1 year को चाहिँ बच्चालाई भन्छ. toddler 1 to 3 years को बच्चालाई pre-schooler 3 to 6 and 6 to 12 लाई schooler age भनिन्छ. Question number 101. A nurse is assessing a child with plumbins, lead poisoning. Which organ system is of most concern because of its irreversible side effect? Urinary, skeletal, nervous, and hematologic. Damaged nerve cells do not regenerate. Once mental retardation has occurred, it is not reversible. So, nervous system, option C. Question number 102. An unconscious child requires intermittent nasogastric feeding. When should the nurse check placement of the tube? Option A, once a day. Option B, before each feeding. Option C, at every shift change. And option D, during the night shift. नर्सको चाहिँ रेस्पोन्सिबिलिटी हुन्छ एभ्री फिडिङमा चाहिँ त्यसको प्लेसमेन्ट चेक गरिराख्नुपर्छ चाइल्डको केसमा। क्वेसन नम्बर 103. What causes the foul smelling fruity stool in a patient with cystic fibrosis? Option A, undigested fat. Option B, sodium and chloride. Option C, lipase, trypsin and amylase. Option D, partially digested carbohydrate. Option A, undigested fat मा चाहिँ यस्तो किसिमको सिम्पटम्सहरु आउँछ because of lack of the pancreatic enzyme lipase, fat remaining unabsorbed and are excreted in excessive amount in a stool. Question 104. After tonsillectomy, which finding alerts the nurse to suspect the initial stage of hemorrhage? Option A, noisy snoring. Option B, asking for water. Option C, frequent swallowing. And option D, gradual onset of pallor. Option C, frequent swallowing is the right answer. Question number 105. How can a nurse best complete therapeutic communication with adolescent? Option A, using teen language. Option B, relating on a peer level. Option C, establishing a relationship over time. And option D, interacting by using the concrete concept. Establishing a relationship over time, option C. Question number 106. A client had extensive prolonged surgery. Which electrolyte level should the nurse monitor most closely? Option A, sodium. Option B, calcium. Option C, chloride. And option D, potassium. The right answer is option D, potassium. इन्ट्राफ्लुड चाहिँ पोटासियम हुन्छ र एक्स्ट्रा भनेको चाहिँ सोडियम आउँछ। त्यही भएर अब सर्जरी गरिरहेको छ भने चाहिँ इन्ट्राफ्लुड लस हुन सक्छ, त्यसै भएर यसलाई चाहिँ मोनिटर गरिराख्नुपर्छ। क्वेसन नम्बर 107. What complication is prevented when a nurse addresses the needs of a client who is hyperventilating? Option A, cardiac arrest. Option B, carbonic acid deficit. Option C, reduction in serum pH. And option D, excess oxygen saturation. The right answer is option C. Question 108. A nurse is caring for a client who is receiving the serum albumin. What therapeutic effect does the nurse anticipate? Option A, improve clotting of blood. Option B, formation of red blood cell. Option C, activations of a white blood cell. And option D, maintenance of oncotic pressure. Serum albumin, a protein, establishes the plasma colloid osmotic oncotic pressure because of its high molecular weight and size. Option D, maintenance of oncotic pressure. Question number 109. What is the maximum length of a time a nurse should allow an IV bag of solutions to infuse? Option A, 6 hours. Option B, 12 hours. Option C, 18 hours. And option D, 24 hours. Option D is right answer, 24 hours. After 24 hours, there is increased risk for contaminations of solutions, and the solutions and the bag should be changed. Question number 110. In what position should the nurse place a client recovering from a general anesthesia? Supine position. Option B, sideline position. Option C, high floor position. And option D, tender birth position. receiving from general anesthesia to maintain sideline position. Option B is right answer. Question number 111. A client has a seeds containing radium implanted in the pharyngeal area. What should the nurse include in the client's plan of care? Option A. Have the client to void every 2 hours. Option B. Maintain the client in an isolation room. Option C. Allow time for the client to verbalize feelings. Option D. Wear 2 pairs of gloves when touching the client during care. Option B is right answer. Maintain the client in an isolation room. Question 112. A client reports severe pain 2 days after surgery. Which initial action should the nurse after assessing the character of the pain? Option A. Encourage rest. Option B. Obtain the vital sign. Option C. Administers the PRN analgesic. Option D. Document the client's pain response. आफ्टर सर्जरी पेन भइराखेको छ भने चाहिँ मेबी त्यहाँ इन्फेक्सन हुन सक्छ सो भाइटल साइन अब्टेन गर्नुपर्छ. ऑप्शन बी इज राइट आंसर. क्वेश्चन नंबर 113. What is the priority nursing actions for a client during immediate postpartum period? Option A. Monitoring vital sign. Option B. Observing for hemorrhage. Option C. Maintaining patent airway. Option D. Recording the intake and output. The right answer is option C. Maintenance of patent airway is always the priority because airway obstruction, breathing and may result in a death. Question 114. A nurse is caring for a client with an impaired immune system. Which blood protein associated with the immune system is important for the nurse to consider? Option A. Albumin. Option B. Globulin. Option C. Thrombin. Option D. Hemoglobin. Globulin. Option B is right answer. Question 115. Which potential danger should the nurse assess in the client with a near drowning? Option A. Alkalosis. Option B. Renal failure. Option C. Hypovolemia. And option D. Pulmonary edema. Potential danger sign is a pulmonary edema. Option D. Question 116. What clinical finding does a nurse anticipate when admitting a client with a extracellular fluid volume excess? Option A. Rapid thread pulse. Option B. Distended jugular veins. Option C. Elevated hematocrit level. And option D. Increased serum sodium level. Option B is right answer. Distended jugular vein. Because of the fluid overloaded in the intravascular space, the neck vein becomes visibly distended. Question 117. Which nursing is the most important when caring for a client after a cardiac catheterization? Option A. Provide for rest. Option B. Administer oxygen. Option C. Check a pulse distal to the insertion site. And option D. Assess the electrocardiogram every 15 minutes. Option C. Check a pulse distal to the insertion site because the trauma at the insertion site may interfere with blood flow distal to the site. There is also danger of bleeding. Question number 118. What should the nurse identify as the primary causes of the pain experienced by a client with coronary? Option A. Arterial spasm. Option B. Heart muscle ischemia. Option C. Blocking of the coronary veins. Option D. Irritations of a nerve ending in the cardiac plexus. The right answer is option B. Heart muscle ischemia. B हुन्छ यहाँ. Ischemia causes tissue injury and the release of chemicals such as bradykinin that stimulate sensory nerves and produce pain. Question 119. What is the priority nursing actions when caring for a client with disseminated intravascular coagulopathy? Option A. Monitor for a human sign. Option B. Avoid giving intramuscular injection. Option C. Take temperature by rectal route. And option D. Apply sequential compression stocking. The right answer is option B. Avoid giving intramuscular injection. Question 120. What clinical findings should the nurse expect when assessing a client who had a splenectomy? Option A. Crackle. Option B. Pain on inspiration. Option C. Shortness of breath. Option D. Excessive secretion. The right answer is option B. Pain on inspiration. Question 121. What nursing action will most help a client obtain maximum benefits after postural drainage? Option A. Administers PRN oxygen. Option B. Encourage coughing deeply. Option C. Place the client in sitting position. And option D. Encourage the client to rest for an half hour. Option B is right answer. Because coughing is needed to raise secretion or expectoration. Question 122. What is the underlying rationales why a nurse assesses a client with emphysema for clinical indications of hypoxia? Option A. Pleural effusion. Option B. Infectious obstructions. Option C. Loss of aerating surface. And option D. Respiratory muscle paralysis. The right answer is option C. Loss of aerating surface, because destruction of the alveolar wall leads to diminished surface area for gaseous exchanges and increased carbon dioxide level in the blood. Question 123. A client just had a thoracosynthesis. For which response is the most important for the nurse to observe the client? Option A. Sign of infection. Option B. Expectoration of blood. Option C. Increased breath sounds. And option D. Decreased respiratory rate. Expectorations of the blood is an indication that the lungs itself was damaged during the procedure, like pneumothorax or hematothorax may occur. So the right answer B. Question 124. Which intervention should the nurse implement to help prevent atelectasis in a client with fractured ribs as a result of chest trauma? Option A. Apply a thoracic binder for support. Option B. Encourage coughing and deep breathing. Option C. Defer pain medications the first day after injury. Option D. Position the client face down on a soft mattress. Atelectasis means impaired gas exchange. Is a major complication when clients are shallow breathing. To avoid pain, coughing and deep breathing help mobilize circulation. So encourage coughing and deep breathing. Option B is right answer. Question 125. Which clinical indicators should the nurse identify before scheduling a client for an endoscopic retrograde cholangiopancreatography (ERCP)? Option A. Urine output. Option B. Bilirubin level. Option C. Blood pressure. And option D. Serum glucose. Bilirubin level is the right answer. Question 126. For which clinical indicator associated with a complication of portal hypertension should the nurse assess the client? Option A. Liver abscess. Option B. Intestinal obstruction. Option C. Perforation of the duodenum. and option D, hemorrhage from esophageal varices. Option D, hemorrhage from esophageal varices. Question 127. What should the nurse do when caring for a client with ileostomy? Option A, teach the client to eat food high in residue. Option B, explain that drainage can be controlled with daily irrigation. Option C, expect the stoma to start draining on the third post-operative day. And option D, anticipate that may emotional stress can increase intestinal peristalsis. Option D is right answer. Emotional stress of any kind can stimulate peristalsis and thereby increase the volume of drainage. Question 128. When teaching irrigation subcolostomy, how many inch above the stoma should the nurse teach the client to place the container? Option A, 15 cm 6 inch. Option B, 25 cm 10 inch. Option C, 30 cm 12 inch. And option D, 45 cm 18 inch. The right answer is option D, 45 cm 18 inch. यहाँ D हुन्छ मिस्टेकली टाइप भएको छ. Question 129. Which information from the client's history does the nurse identify as a risk factors for developing osteoporosis? Option A, receives long-term steroid therapy. Option B, has a history of hypothyroidism. Option C, engage in strenuous physical activity. Option D, consumes high dose of the hormonal estrogen. Demineralization. Option A is right answer. Question 130. A client is diagnosed with diabetes ketoacidosis. Which insulin should the nurse expect the healthcare provider to prescribe? Option A, insulin Lispro. Option B, insulin Largin. Option C, NPH insulin. And option D, regular insulin. Diabetic ketoacidosis मा चाहिँ रेगुलर इन्सुलिन दिनुपर्छ. Option D is right answer. Question 131. What should a nurse do immediately when a client returns from the post-anesthesia care unit following a subtotal thyroidectomy? Option A, inspect the incision. Option B, instruct the client not to speak. Option C, place in a supine position for 24 hours. And option D, place a tracheostomy set at the bedside. Place the tracheostomy set at the bedside is the right answer. Question number 132. For which clinical manifestation should the nurse assess a client with metastatic melanoma? Option A, willy skin. Option B, Nichols sky sign. Option C, lymphadenopathy. And option D, erythema of the palms. Lymphadenopathy occurs in a client with a malignancy that has metastasized. Option C is right answer. Question number 133. Which response indicates sympathetic nervous system control in anxious and fearful client? Option A, dry skin. Option B, skin pallor. Option C, constrictions of pupils. And option D, pulse rate of 60 beats per minute. The sympathetic nervous system constricts the smooth muscle of blood vessel in the skin when a person is under stress. Constriction of pupils. Question number 134. A client had a brain attack and bed rest is ordered. What can the nurse use to best prevent food drop in this client? Option A, splints. Option B, blocks. Option C, cradles. And option D, sandbags. Splints is the right answer. Question 135. A client is diagnosed with a trigeminal neuralgia. Which medication should the nurse anticipate will be prescribed for this client? Option A, ascorbic acid. Option B, morphine sulfate. Option C, allopurinol. And option D, carbamazepine. Option D is right answer. Carbamazepine is a narcotic, analgesic, anticonvulsant drug used to control pain in trigeminal neuralgia. Question 136. A client with a myasthenia gravis asks the nurse why the disease has occurred. What pathology underlies the nurse reply? Option A genetic defect in the production of acetylcholine. Option B, an insufficient use of the neurotransmitter acetylcholine. Option C, a decreased number of functionally acetylcholine receptor sites. Option D, an inhibition of the enzyme acetylcholine, leaving the end plates folded. The right answer is option C. Question 137. What nursing intervention is anticipated in for client with Guillain-Barré syndrome? Option A, providing a straight to stimulate the facial muscle. Option B, maintaining ventilator settings to support respiration. Option C, encouraging aerobic exercise to avoid muscle therapy. And option D, administering antibiotic medication to prevent pneumonia. Guillain-Barré syndrome is a progressive paralysis beginning the lower extremities and moving upward. Mechanical ventilation may be required when respiratory muscles are affected. Maintaining ventilator setting to support respiration. Option B is right answer. Question number 138. Which nursing action is a contraindication when caring for a client with a newly applied long layer cast? Option A, elevating the cast on a pillow. Option B, drying the cast by using a fan. Option C, leaving the cast exposed to air. Option D, handling the cast with fingertips. Option D is right answer. Question 139. When helping a client with Parkinson's disease to ambulate, what instructions should the nurse give the client? Option A, avoid leaning forward. Option B, hesitate between steps. Option C, rest when tremors are experienced. Option D, keep arms close to the center of gravity. The client with Parkinson's disease often has a stopped posture because of the tendency of the head and neck to be drawn down. They shift away from the center of gravity, causing instability. So option A, avoid leaning forward is the right answer. Question 140. When should the nurse begin the process of rehabilitation when a client is scheduled for ambulation? Option A, before the surgery. Option B, during the convalescent phase. Option C, on discharge from the hospital. Option D, when it is time for a prosthesis. The right answer is option A, before the surgery. Question 141. Which position should a nurse avoid placing a client who had surgery for a total hip replacement? Option A, supine. Option B, lateral. Option C, orthopedic. And option D, semi-flawed. Option C is right answer, orthopedic. Question 142. A nurse plans to care preventative remedies in a client with rheumatoid arthritis. Which intervention should be altered with the periods of? Option A, active exercise. Option B, passive massage. Option C, bracing of joints. And option D, isometric exercise. The right answer is option A, active exercise. Question 143. Which actions of nurse can best prevent infection from a urinary retention catheter? Option A, cleaning the perineum. Option B, encouraging adequate fluids. Option C, irrigating the catheter once daily. Option D, cleaning around the meatus routinely. To prevent infection from a urinary retention catheter, to cleaning around the meters routinely. Option D is right answer. Question 144. A nurse is assessing the urine of a client with a urinary tract infection. For which characteristics should the nurse assess each specimen of urine? Option A, clarity. Option B, viscosity. Option C, glucose level. And option D, specific gravity. The right answer is option A, clarity. Question 145. A client is to have a hemodialysis. What must the nurse do before this treatment? Option A, obtain a urine specimen to evaluate kidney function. Option B, wait the client to establish a baseline for later comparison. Option C, administers medications that are scheduled to be given within the next hour. Option D, explain that the peritoneum serves as a semi-permeable membrane to remove waste. The right answer is option B. A baseline weight must be obtained to be able to determine the net fluid loss from dialysis. Question number 146. Syphilis is not considered contagious in which of the following stages? Option A, tertiary stage. Option B, secondary stage. Option C, primary stage. And option D, incubation stage. The right answer is option A, tertiary stage. Question 147. Which action should the nurse take when caring for a client with malaria? Option A, institute seizure precaution. Option B, prepare for blood transfusion. Option C, maintain isolation precaution. And option D, provide nutrition between paroxysm. Option D is right answer. Maintaining adequate nutritional and fluid balance is essential to life and must be accomplished during the periods when intestinal motility is not excessive so that absorptions can occur. Question 148. Which client health problem motivates the nurse to question a prescriptions for a beta blocker? Option A, heart failure. Option B, hypertension. Option C, sinus tachycardia. And option D, coronary artery disease. Heart failure को लागि beta blockers reduce the cardiac output, so they are contraindicated for client with a uncontrolled heart failure. Question 149. Which test results should a nurse review to determine if the antibiotic prescribed for the client will be effective? Option A, serologic test. Option B, sensitivity test. Option C, serum osmolarity. And option D, sedimentation rate. Option B is right answer, sensitivity test. Question number 150. A client with a history of tuberculosis reports difficulty hearing. Which medication should the nurse consider is related to this response? Streptomycin, parazinamide, isoniazid, and ethambutol. The right answer is option A, streptomycin. Thank you so much and all the best to all.